Hi guys, as you see today I'm gonna focus on the shoulders muscles. So shoulder joint is one of the complex joints of the body. So we have lots of muscles involving in moving the shoulder joint. So I'm gonna focus on the shoulder muscles, and mainly I'm gonna simplify and classify those muscles. These days my students ask me how we can remember all those muscles. So in the textbooks I couldn't find any great classification. So believe me, I'm just thinking about classification of these muscles for 2 weeks, and now I'm gonna do it for you. So stay with me today to show you how you can learn all those muscles. So here we have, my friend is here. This is the skeleton, whole body skeleton. In the skeleton you can see the axial skeleton. This is the axial skeleton, which is comprised of the head, and from the posterior view you can see the vertebral column and the ribs. And we have also appendicular skeleton, upper limbs and lower limbs. So you can see how the upper limb connecting to the axial skeleton. Look at here, we have anteriorly a clavicle. The only bone that is connecting the upper limb to the axial skeleton is the clavicle, which is articulating with the sternum and make a sternoclavicular joint. So as you see here, scapula does not articulate with the axial skeleton. It does not articulate with the ribs or vertebral column. It just articulates here with the clavicle and articulates with the head of the humerus and makes the shoulder joint. So it just hanging here with 15 muscles. So this makes a movable shoulder joint. So you can see it gives your shoulder joint a great range of movement. So today I'm gonna show you how to classify all those muscles that are connecting the scapula to the axial skeleton, and they are known as the axioscapular. And then we have some muscles connecting the scapula to the humerus, axiohumeral, scapulohumeral. Axioscapular muscles, scapulohumeral, and we also have some muscles connecting the axial skeleton to the humerus. It does not attach to the scapula, they're crossing the scapula, and they're known as the axiohumeral. So we have three different categories. First, axioscapular, we have 6 muscles, 4 at the back, 1 on the lateral side and 1 at the front. 6 axioscapular and 6 scapulohumeral. Okay, 12 muscles. And then we have 2 axiohumeral that does not attach to the scapula, just crossing the scapula and attaching the humerus. 2 muscles. 6 plus 6 is 12, plus 2, 14. So I'm gonna show you all those 14 muscles and try to show you the action, origin, how they're working on the movement of the scapula, and finally the movement of the shoulder joint. So I'm gonna show you the first class, which is known as the axioscapular. As I mentioned, in this category we have 6 muscles, 4 at the back, 1 on the lateral side of the rib and 1 at the front. Now you can see this great model from the posterior view. So you can see this large muscle. The more superficial muscle, the larger muscle. We have large global superficial muscle. When you get deep to this, we have some small local muscle. So as I mentioned earlier, on the bone skeleton, we have 6 muscle, which is connecting the axial skeleton to the scapula. 4 at the back, 1 lateral, 1 posterior, 1 anterior. So at the back we have 4 muscles. One of them is the largest one, is the trapezius. This is the trapezius muscle. So as you see here, it's coming from the skull. Yeah, you can see here if you look at closely, this is the skull, and it also attaches here, ligamentum nuchal ligament, and also attaches to the spinous process of the thoracic vertebrae. So if you look at here, we have an inverted L-shaped attachment site for the trapezius, and the muscle fibers converging together and attaching here to the spine of scapula, to the acromion process of scapula, and lateral 1/3 of the clavicle. So it makes a U-shape connection. So we have 3 different types of muscle fibers for the trapezius: upper trap, middle trap, and lower trap. So what is the action of the trapezius? Actually, trapezius, the upper trap, can elevate, pulling up the scapula. In contrast, the lower trap can depress the scapula, and the middle trap can do the retraction, pulling the right and left scapula together. It's called retraction, pulling back together. So when the upper trap and lower trap working together, they can do upward rotation or lateral rotation of the scapula. What is the meaning of the upward rotation? So if you look at here, imagine that the upper trap coming from here attaches to the scapula and clavicle, lower trap coming from there and attaches here. When they are working together, this one, the upper trap pulling the scapula up, lower trap pulling down. So when they are working together, they can do upward rotation or lateral rotation. So if you look at the inferior angle during the lateral rotation, the inferior angle rotating laterally, or if you look at the glenoid fossa during the lateral rotation or upward rotation, it faces upwards. So both of them are correct. They are interchangeable: upward rotation or lateral rotation. So the second muscle would be just deep to the trapezius. I'm gonna take the trapezius off. Deep to the trapezius, if you look at here, we have 3 muscles connecting the medial border of the scapula to the axial skeleton. So from superior to inferior, we have levator scapulae, and this one is the rhomboid minor, and here we have rhomboid major. So this is the rhomboid major. All these 3 muscles connecting the medial border of the scapula to the axial skeleton, to the cervical spine and thoracic spine. So what is the action of the levator scapula? As its name tells us, when it contracts, it can elevate, pulling up the scapula. It can also contribute to the other actions that I'm going to mention later. So here we have the rhomboid. Rhomboid minor attaches here at the level of the root of the spine of scapula, and the rhomboid major attaches below the spine. So what is the primary action of these muscles? Primarily, they can retract. So they can help the middle fibers of the trapezius and retract. So look at here. Here we have the middle fibers, so they can do retraction. What is the meaning of the retraction? If you look at here, imagine that these are the right and left scapula. So middle trap attaches here. The muscle fibers are transverse fibers. And the rhomboid minor and major attaches there. So rhomboid minor, rhomboid major, and middle trap, they work together to do retraction. During the retraction, the medial border of the 2 scapulas getting closer together. So it's called retraction, like this. So the other action of the middle rhomboid minor and major is that They can help the levator scapula to pull the scapula up, pulling the scapula up, elevating the scapula. And the other action is downward rotation. Look at the muscle fibers direction of the rhomboid minor major. So when you are raising hand above your head, so upper trap and lower trap, they are rotating your scapula laterally, lateral rotation. In contrast, rhomboid minor, rhomboid major, and also levator scapula, they're working together and they can do downward rotation. So this is the upward rotation, which is doing by the trapezius, upper lower trapezius, upward rotation. This is downward rotation. So rhomboid minor and major muscle fibers is like this. They are oblique. They can do downward rotation. So retraction, downward rotation, and also they can help the levator scapula to do elevation. So these are the four muscles. They are known as the axioscapular: trapezius, levator scapula, rhomboid minor, rhomboid major. We also have two axioscapular muscles. One of them is coming here. Actually, they are attaching to the lateral surface of the rib 1 to rib 8 or even rib 9, and they're wrapping around the ribs and attaching to the medial border of the scapula. So if you look at here, this is the serratus anterior connecting the lateral surface of the rib 1 to rib 8 to the medial border of the scapula. So you can find the serratus anterior muscle fibers here on the lateral side of the trunk. So as I showed you on the screen, serratus anterior attaches here to the medial border of the scapula, and then it wraps around the ribs here, rib 1 to rib 9, and attaches to the lateral surface of the ribs. So what is the action of the serratus anterior? As it attaches to the medial border of the scapula, when it contracts, it can pull the scapula forward, which makes the protraction. So this action is known as the protraction. So when it contracts, it would be here. When it contracts, it can pull the scapula forward, and it allows the upper limb to go forward. So imagine that when you are taking an object which is far away from you and you couldn't take that object, you need to pull your scapula forward, which allows your upper limb to go forward to take that object. So this is known as the protraction. In contrast, we have the retraction. During the retraction, as I mentioned earlier, the medial border of two scapula are getting closer. So like this is the retraction. Protraction, retraction. So the muscles like rhomboid major, minor, and middle trapezius, they do retraction. Protraction, retraction. The last muscle that I can show you would be the pectoralis minor. I can show it here in this model. From the anterior view, you can see the pec major. This is the pectoralis major. Deep to the pectoralis major, we have another pectoralis muscle. It's called pectoralis minor. It attaches to the rib 3, 4, and 5, and the muscle fibers goes up and laterally and they attach to the scapula. Which part of the scapula? There is a process, it's known as the coracoid process. This is the coracoid process. Rib 3, 4, 5 connecting to the coracoid process of the scapula. So it's another axioscapular muscle. So if you look at here closely, this is the coracoid process. Here is the rib 3, 4, 5. So the pec minor connecting these three ribs to the coracoid process. So when it contracts, it can primarily pull the scapula down, and it can also do protraction, so it can help the serratus anterior to do protraction. It can also help the rhomboid minor and rhomboid major to do downward rotation, but primarily it can do depression of the scapula. So I showed you 6 different muscles of the axioscapular, connecting the axial skeleton from back and from front to the scapula, and they can do different movement like protraction, retraction, elevation, depression, and they can also do upward rotation and downward rotation. So during the upward rotation, as I showed you, the glenoid fossa faces upward, and opposite to this we have downward, or lateral rotation, medial rotation, angle, inferior angle of the scapula goes laterally, medially. So all these 6 movements are happening here between the medial end of the clavicle and sternum. This joint is known as the, sternoclavicular joint. It is referred as the SC joint. S is sternal, C is clavicular joint. So as I showed you at the beginning of this video, the scapula does not articulate with the axial skeleton. It just articulates with the clavicle and humerus, and clavicle articulates with the sternum. So when you are doing these 6 movements, which is the result of the contraction of 6 axioscapular muscles, you are actually moving this joint. So if you put your hand on your clavicle and on your scapula, this is my spine of scapula, and do elevation and depression, you can feel that both clavicle and scapula, they are going up and down at this joint, sternoclavicular joint. If you are doing protraction and retraction, all these 2 movements resulted in moving the clavicle and scapula forward and backwards. And when you are doing upward rotation, when you're raising your hand, you are doing upward rotation and downward rotation. Again, both clavicle and scapula are moving. So totally the scapula and clavicle are called shoulder girdle. So we have scapula, clavicle, they are known as a shoulder girdle. So I showed you 6 axioscapular muscles. I showed you this muscle that would be the trapezius from the back, the large muscle. This is the trapezius. Just deep to the trapezius, I demonstrated you the rhomboid major, rhomboid minor, levator scapulae, and finally I showed you the pec minor. And down here, we cannot see here, we have the serratus anterior. All these 6 axioscapular muscles do 6 different movements, which are moving the shoulder girdle. Next video, I'm gonna focus on the scapulohumeral, the muscles that are connecting the scapula to the humerus. It's called the scapulohumeral, and which is moving the shoulder joint. Stay with me. Thank you so much for your attention.